Have you ever known you needed help but had absolutely no idea where to start? Do you call a therapist, a psychologist, or a psychiatrist? What if they judge you? What even happens when you walk through that door for the first time? If you've ever had any of these questions, then this video is for you. In the last episode of my podcast, I outlined several ways to deal with intense, overwhelming sadness. We also talked about the difference between sadness and depression. Also, very importantly, we mentioned that sometimes it is important to seek professional help when sadness persists for more than 2 weeks, your regular life and routine is being severely interfered with, if trauma is involved, or you're having panic attacks, or maybe you're starting to have thoughts of self-harm. But maybe you have no idea where to start from, who to talk to, how to go about it, and what to expect. Well, then you would want to watch this video all the way to the very end. Let me first of all remind you that there is nothing wrong with seeing a professional or going to therapy, because it just means that you are reasonable enough to acknowledge that you have a problem that you're going to need help with. However, going to therapy does not mean you are insane. You consult a doctor when you are having any physical symptoms that you can't handle by yourself. And so it's the same with emotional issues. So, who should you talk to? Let's break down different professionals that could help. A therapist or counselor helps you talk through your emotions and develop coping skills. This is a good first stop for most people. A psychologist is trained to assess and treat mental health conditions using therapy. A psychologist does not usually prescribe medication. A psychiatrist is a medical doctor who specializes in mental health. He can diagnose conditions and prescribe medication if needed. But if you don't know where to start, your regular doctor can assist you and refer you to the right professional. You do not have to figure it all out on your own. So how do you actually get help? Talk to someone you trust. Search for licensed professionals in your area, or ask your doctor for a referral. You could also check whether your workplace, school, or university offers counseling. Then you book an appointment and be honest about what you're experiencing. Remember that you really don't need the perfect words. Just speak your mind the way you feel like it. The first session is usually about getting to know you. They may ask, what brought you in? How long have you felt this way? How are your relationships? Are you sleeping well? What are you hoping to get out of therapy? It's completely okay to not reveal certain things that you are not comfortable with at the beginning. It's okay to be nervous. It's okay to not know where to begin. Finding the right therapist is a bit like finding the right pair of shoes. A therapist might be highly qualified, but still might not be the best fit for you. So it's okay to try someone else. Seeking professional help is not a sign that you're weak. It's a sign that you're taking your mental health seriously. Just as we see a doctor for persistent physical pain, it's okay to seek expert support when our emotional pain has become difficult to carry alone. If this video answered the question you've been having, or if there is another mental health topic you'd like me to cover, let me know in the comments. Also, be sure to check out the Red Button podcast on any of your favorite listening platforms. See you in the next video.